open big. Oh my gosh, look at all those teeth. I like dealing with kids because you never know when one's going to say something that will just completely make your day. We see kids with pristine dental health, and then we see a lot of children who have some pretty devastating oral health conditions.
The Delta Dental Foundation is completely committed and only focused on eradicating cavities in Colorado's children. Who doesn't like to work on efforts that are aimed at children? They are the innocents, and they are our most vulnerable citizens in Colorado. Early on, there's a window of opportunity to prevent cavities from happening in the first place.
Cavity Free at 3 is a state initiative, and our goal is to get children to be cavity-free by the age of 3. Statistically, about 3% of 1-year-olds actually go to the dentist, and we'd like to change that. What we're here to do today is to plant a seed in the first-year dental students about seeing young children.
Do you want to brush my kangaroo's teeth?
What to look for in the children's mouth.
Open really, really big.
We're going to show them an infant oral care exam and also applying a fluoride varnish.
You are great.
One of the messages is that general dentists have an ability and even a responsibility to be concerned about the prevention of early childhood caries. Also to let them know how medical providers who actually see these young children even more often than the dentist will see them, how we can contribute to counseling parents about oral hygiene and about diet, about the importance of brushing the child's teeth and getting the children to see a dentist for the age 1 dental visit.
We recognized years ago that if we really wanted to make an improvement in oral health in the country as well as in the state, we needed to have an interprofessional approach to combating disease. And so the Frontier Center, funded by Delta Dental Foundation, allows us to change curriculum not only in this school but all the other schools on campus to accomplish that.
What's happening behind us is our physician assistant students from our first year class are interacting with dental students who are teaching them to perform the physical exam and assessment and to apply fluoride varnish, which is part of a program that we've implemented in the PA program to encourage our students to do more with oral health and consider oral health part of overall health.
Everybody seems really excited to gain knowledge in other areas that they either have limited experience in or that they feel uncomfortable really working with. It's always nice to be able to help pass that knowledge down and to get everybody involved.
I hope they would take away a renewed sense of what it means to be a primary care clinician and how this integrates very nicely with that mission.
At Bayard Enterprises, we create jobs for people that have disabilities and/or economic challenges. We started the program in August of 2008, so we just completed our 4th, starting our 5th year of involvement with the Cavity Free at 3 program.
Through my car accident and my purpose, I really don't know what my purpose is right now. So I'm trying to find myself so I can do everything on my own. That's why I'm here with the voc rehabilitation evaluation, to just get me further in life.
I have no education, but through Bayard, I'm able to build my confidence and surround myself with my friends.
The impact has been significant on a lot of people. It also has given us a chance to incubate a business. That business has produced over 40,000 kits, so 10,000 a year on average. We've obviously seen the growth of the use of this product, and it's getting out there. It's being used by people. Of course, the long-term hope is that as a result of that and better oral hygiene, particularly for infants, will improve and reduce healthcare costs. That's all very relevant. We feel like we're playing a small part in that. That makes us proud.
couple of years ago, we started to realize that the oral health of patients was being neglected and that medical providers had a role in this. And so the Cavity Free at 3 program was developed. And what that program is it's involving medical providers on the prevention of oral health disease by giving them an education and an education of how they can help their families develop good behaviors at home, how to brush their teeth, how to eat healthy. And also we teach doctors how to examine the teeth and also apply fluoride varnish, which is a vehicle that can strengthen the enamel of the teeth.
He's got some cavities, unfortunately.
So we saw Jonathan today. He came in for his 3-year-old well child care visit. And he generally is a healthy kid. You might have noticed that he had a birthmark on his eye that made his eye a little bit dark, and that's really not a problem for him, but unfortunately when I looked into his mouth, he had 5 cavities. And that's his primary problem today, is his teeth.
Most of us don't really realize what kinds of problems can be caused by rampant oral disease in little kids. Little kids like Jonathan are why the foundation is here. When a little child has rampant disease, they can't eat right, they can't sleep right, they can't learn, they can't engage with their environment the way they should because they're in constant pain, and they probably don't even know it because they've never known anything like that.
In our Denver health population, we unfortunately have a lot of dental disease. We measured the number of cavities in our 3-year-olds a couple of years ago, and over half of them have cavities, and a lot of them have as many cavities or more as Jonathan did. If I look at a stack of charts, the most common diagnosis in all of those charts is cavities, but that's what's preventable in all those charts. And so that's what's nice about the Cavity Free at 3 program, is starting to attack this preventable disease that's so prevalent. Unfortunately, Jonathan has still got cavities, but we are seeing a difference, and we're seeing that families care about their kids' teeth. They're starting to take care of their teeth better, and the medical providers are also engaged in the program.
That's why we're here. We want to see that end, and we believe we can make it a thing of the past.